And now I think we will be able to listen to one of the very, very important talk given by Major General Amir Ikram. He is a fellow of Pakistan Academy of Sciences. He's an executive director of National Institute of Health. I know him personally, being a member of the Board of Governors of NIH. His work, his contribution, and the contribution of the National Institute of Health in the health services of Pakistan, and particularly during this pandemic. I think it's our premier organization, and the efforts, the contributions of National Institute of Health and General Amir Ikram is highly commendable, and he will be giving us a detail about the COVID situation in Pakistan and its perspective. I would now take this opportunity to invite Major General Amir Ikram, Executive Director, National Institute of Health. Over to General Ikram.
Thank you so much. Bismillah ar-Rahman ar-Rahim. I'm extremely grateful, sir, to you for your kind words, and in particular to Pakistan Academy of Sciences as well, Dr. Zabta and all other colleagues who are there, and the international participants. We all know we are in a challenge, but such challenges do bring in opportunities to find the gaps, to plug the gaps and deliver. And I think delivery is totally dependent upon dedication, and that's what we have done in this country. We are putting a very robust fight. Briefly, I'll be taking you along to the COVID perspective. Sorry, my slides. I hope you can see the slides. Everything is fine, and hear me as well clearly. So I'll continue now. Now, what happened? I mean, definitely the coronavirus, once it started in China, end of December, and then towards 2019, the virus was picked up very rapidly. The whole genome sequencing was done, and it was relayed internationally as well. So far, as we understand, 152 million cases have been there international at the global level, and killing unfortunately a good number of people suffering from the COVID-19 disease. We all are monitoring different sites. Now, this is one of the very robust data site from the Johns Hopkins site, and in the light of that, definitely we have got our own dashboard at the national level, monitoring the situation very closely. We can compare different versions, the recent past infections. Well, every decade is known for a pandemic otherwise. And we have witnessed, but very well controlled MERS and SARS in the recent past, but now coming down to Corona, which unfortunately is playing a bit of havoc with the country. Now, what happened in last year, January, we started closely monitoring the situation at the National Center, and Public Health Emergency Operation Center was activated at National Institute of Health. Different stakeholders like National Disaster Management Authority, other stakeholders, including international partners like WHO and local partners like Central Health Establishment, looking the point of entries, were all incorporated, and similarly help desks were placed at all the international airports. Now, what happened was later on, the main strength was provided by the government through establishing a national coordination committee headed by the Honorable Prime Minister himself, and moving on to establishing a national command and operation center, which is functional till today very amicably. And it brought all the stakeholders into loop, whether national, international, and again, things were consolidated, and methodology has been very structured. Well, if you talk of concepts of operation, I'm sorry, I will not be bothering you with the lecturing sort of a thing. Just to give you the three levels which needs to be incorporated. Number one is the strategic level, then talking of tactical levels, and then the operational, which is the most important, whereby you go for the implementation. Now, this is basically our own tactical level within NIH, a very consolidated, and fortunately, for the last 2 to 3 years, we have been revamping National Institute of Health based upon international models. And that is one of the reasons that we have given a very robust fight at the national as well as international level. This is basically the structure of our own emergency operations with the management system, having an operational planning, logistic, and different sections underneath this one. Now, if we talk of partners, we have been closely working with WHO and others like Public Health England, US CDC, CDC China, and all others. And it has been playing a key lead role. And this was for the first time that a national action plan totally dedicated to COVID was prepared, and side by side drills, triage, hands-on exercises, and all were launched together. And I think this has played very well in the country. If you talk of the surveillance, definitely we started off from our own epidemiology division, but as we move on, we have a certain system already incorporated all across the country, whereby we had 20 disease surveillance and response units in different parts of the country. And surprisingly, during this crisis period, we have established 155 DSRUs at the district level, almost all 155 districts existing in the country, and they have been integrated. And now we are launching the IDSR system, which in particular is integrated disease surveillance and response. We have got a grant of 4.5 billion approved from the government side for that. Now, something have been very important internationally. We also launched our operation for the passenger surveillance at the airports, making calls to them, make contact tracing. And just to give you an example, the first case that landed in Pakistan and turned out to be positive in Islamabad, we were able to trace out 167 personnel who came in contact, including those passengers sitting next to him over the plane as well. This contact tracing in Islamabad alone, we have got 5 rapid response teams. But what we did was we prepared all across the country. Our teams have been imparting training. We have a good number of qualified field epidemiology trained specialists, and they were trained as the master trainer so that they can work in different parts of the country and can keep training further. Now, one of the rules for the camp by eventuality is you cannot prepare, but it's such a long eventuality and such a grave situation that you need to keep imparting trainings as to move on within the country and also extending help beyond the borders as well. The second most important thing has been the diagnostics. And I still remember the day once we received the initial PCR kits through the courtesy of Chinese government, and we had a capacity of 300 PCR tests for COVID in a day. And from there we started off. And as we moved on, today we have labs all across the country. We have more than 190 labs performing PCR all across the country in almost all parts. And the strength is that we can perform around 200,000 PCR tests in a day. And not only that, we also started providing trainings and equipment to far off areas, and side by side launching a quality assurance system, because the results have to be quality controlled and quality assured, and only then they become meaningful. Now, this is for the first time that we also launched a mobile biosafety level 3 lab in far-flung areas. We started off with Afghan border, where NIH teams have been working for almost a year's time, and now they have moved to Gawada. So just to have you a glimpse, we are maintaining a robust record of all public, private, and other government labs within the country. And we make sure that we stay in touch and provide them the quality assurance guidance is there. We also launch point of care diagnostic at all the borders like Taftan, Dorfamsus, and so on. Now, one of the very important aspects, I mean, as Tedros, the WHO had also said, we are not fighting a pandemic, we are fighting infodemics. So I think in order to have a very robust system, you need to have a risk communication system. And what we have done that initially from NIH platform, then the ministry, and now from the National Command and Operation Center, we have got a very robust system of communication whereby different stakeholders, including ISP, are involved. We have been developing policies and they are disseminated all across the country. And then one of the very major aspects has been the infection prevention and control. What we did was launching another system within the country, whereby imparting hands-on training to the healthcare workers, actually fighting the disease on the forefront. Just a few glimpses during this crisis period for that. And then for the first time, we also launched a daily set trip system through NIH. Then it was taken up by ministry, then taken up by the NDMA, and now a very robust system coming again from National Command and Operations Center. The different policies, advisories, different technical committees formed by the ministry at different levels, they have been actively engaged, not only main aspects of surveillance, but going beyond, much beyond. And one of the main things that was established in the early days, that the hotels and quarantine centers, conversion of hotels into quarantine centers, yet this was a big testing and challenging time, but we imparted training to all others who were concerned. There are 19 points of entries, including air, sea, and ground. Our teams have been to almost all parts of the country, even far-flung areas I have mentioned earlier, Taftan. And not only that, we also provide them personal protective equipment so as to move on with the requirements. The National Action Plan has been very robust and it's a live document. We keep refining it as per the requirements. And if we talk of NIH, we have been actively engaged with the research, and some of the very important things that we started in the very early days is the detection of the virus from the sewage sample. This has been published in a high impact factor journal now, and we have already 60 collection points within the country and 20 within Afghanistan, whereby we bringing the sewage sample and test them for various things. We utilize the same thing, but moving on to COVID, and as you understand that the virus can appear 4 to 5 days earlier before it can cause disease in a certain area. So it's a very important from the viewpoint of public health. Similarly, we started the genomics and genomic surveillance. We are closely monitoring right now. The recent third wave has been more so because of the UK strain, but recently we have also detected the Brazil and South African strain in 2 individuals. We have submitted more than 70 publications in the international high impact journals, out of which 26 have been published. And we are working on some very high profile research projects whereby we have conducted studies on macaque monkeys, and now we are analyzing the human center. We are trying to bank upon the modeling, immunomodulation, artificial intelligence, and all those for different things. And I would request anyone who would like to join hand from the international or national level. We are having a very open policy. Now, moving on, a hospital has been established within NIH premises, totally dedicated to infectious diseases and currently looking after COVID patient. It was established in record days of 45 with the help of Chinese grant. The Honorable Prime Minister himself inaugurated it. And then side by side, we have been having multiple Chinese expert teams with having hands-on experience arriving in Pakistan and guiding us for different modalities. We definitely always remain grateful to China for all the support that has been extended. During this period, we launched a Center for Occupation and Patient Safety within NIH with the main aim of looking after the hospital infection control. We launched the national guidelines as well, and our teams are imparting continuous online trainings now all across the country. We have been on the forefront in facilitation of Ministry of Foreign Affairs, Armed Forces. We have been working closely together, the law enforcement agencies, and all others who are required one way or the other. Now, for the first time, we brought in a phase 3 clinical trial in the country. We conducted on more than 17,500 participants, the CanSino Bio trial. As it was the first, we wanted to ensure that it's a successful trial. Alhamdulillah, it's been very successful. The results for Pakistan, the safety was excellent, and efficacy was around 74.7%. Now, this vaccine, inshallah, we are grabbing the opportunity with stage 2 transfer of technology, and we'll start manufacturing soon at National Institute of Health. Side by side, we have been constantly in touch with Sinopharm, Gamaleya Institute in Russia, and we are also in contact with the different deliberation with the other companies like AstraZeneca, Pfizer, and so on. But right now, we are mainly banking on the Chinese vaccines. Now, some of the things that have been established for the first time and have been very effective under the National Command and Control Center is the TTQ, which is the testing, tracing, and quarantine, but formal softwares for that. And then we launched another app by the name of Pakistan Negeban as an emergency response. And then we started for the first time with the policy of smart lockdown technique within the country. As you understand, we never underwent complete shutdown, and it's been mostly this picking up the hotspots through our artificial intelligence-based program, and then having smart lockdown in those areas. And that definitely there is a real-time decision support board for all these activities being managed at the National Command and Operations Center. So with all that, NIH never stopped performing at the National Center. But at the end, I think there's so much to share, but with the shortage of time and your other commitments, I would say the message still remains, we have to stay at home. We have to work on social distancing in order to make us and others very safe. Once again, I'm extremely grateful to all of you for giving me this opportunity to talk to you. And inshallah, we make sure that we collectively work, because it's only collaboration, cooperation, and coordination that we can make this thing much better. So thank you so much, sir. Once again, thank you to you all. Thank you.
Thank you very much, Janusab, for very, very informative presentation. I think we all appreciate the work done by NIH and the lead taken by yourself. And we hope that we'll be out of this pandemic very soon. I'm going to further speaker. I just want to ask a quick question, which is very relevant to you, because we were taking this question answer session at the end. But this is something which I think you will be in a better position to answer. This question came from Muhammad Ibrahim, and he's asking, what is your prediction for how long this pandemic is expected to prevail? What about its intensity in terms of death in coming days? So this is, I thought that this is a very, very important question, and everybody in this country desires to know your expert opinion on this question. Please.
Yeah, let me share. I mean, definitely we are into third wave now, and the third wave definitely is basically driven by the UK strain mostly. I would say 80 to 90% in different parts of the country, it's the UK strain. We fought very well when the first wild variant, that it was D614G arrived, and the first wave, I mean, putting in some good effort, and the second wave coming down to the third wave. We have been involved with the mathematical modeling, predictive modeling, AI-based different models. We have been closely working some very international, like London School of Hygiene, Johns Hopkins University. What we see with our own experience now is we are into third wave. And Alhamdulillah, we are in a state of plateau right now. On the average, getting 4,000 to 5,000 cases all across the country. Again, putting on some restrictive measures. And that's one of the main reasons that for the first time, we'll be going off for the Eid holidays from one weekend to another, almost 9 days. The main reason is the social distancing. Now, my humble, if we keep maintaining the social distancing, hand washing, and mask wearing, we are quite positive that we can sustain this plateau. And down the line, if we reach the end of May and early June, when we have the hot and humid season settling in, we are quite sure that we would be able to sustain. The other concern, that is the variants. Now, if you talk in particular, Brazil strain, the UK, beyond UK strain, the Brazil, South African, we've got the Indian strain, which is a double variant, and now we have the Californian and the New York strain as well. Now, considering all this possibility, traveling as less as possible, strictly monitoring the passenger, ensuring quarantine policies, and the way we are going, alhamdulillah, because the third wave was really picking up very rapidly till the time we launched certain measures. And I think school and academia has to remain closed for some more time in order to avoid the spread. With all these measures, we are quite sure that right now we are at plateau, and if we can sustain it down the line toward the end of May, we would be able to go down, inshallah. And let's hope there is no other variant coming across to the country. And the second thing that we need to is vaccination. We need 70% immunity all across the country in order to be in a place where we can call that we are reaching some safe state. With all that in mind, I would request again the audience, those who are eligible, and whenever their time comes, please go for the vaccination. Thank you so much.
Thank you very much. And so it's very encouraging. Your point of view, we are all very delighted to hear that, that the work is being done very efficiently, and the government and organizations related to our health services are performing their duties very well. And we also promise that we as a nation will be cooperating, particularly during this during the end of Ramadan and the Eid. And this is very important, that if we behave very responsibly during the Eid, we will be able to flatten the curve. Thank you very much, Jain Saab. And